What women with epilepsy should know about their anti-epileptic drugs and contraception include the fact that several anti-epileptic drugs interfere with the contraceptive pills. In addition, the contraceptive pills may interfere with the anti-epileptic drug and for some anticonvulsant drugs. So it's important to talk to your doctor to understand whether there's effects this way or not. If the medicine affects the birth control pill, the birth control pill may not work as well, and you may need to consider a different type of contraception. And if the birth control pill interferes with the medication, then it's important to know that and to be able to adjust the medication dose. What are the chances that a woman with epilepsy is going to have a normal baby? Despite the increased risk, the vast majority of babies are normal. And if we manage on the front end and try to pick safer drugs and get the seizures controlled, then their risk is even less. The important factors to consider before you get pregnant, and really this should occur very early on, whenever you start an anticonvulsant drug if you're of childbearing potential, are which drug is best to control your seizures. If a woman has seizure control for 9 to 12 months going into the pregnancy, she's likely to remain completely seizure-free during the whole pregnancy. It's also important to understand the relative risks of drugs so you can help your doctor make the right choice for you in regards to drugs that might be higher risks for the baby for malformations or for cognitive or behavioral problems. You should be sure that you're taking folate, because there's clear evidence in the general population that folate that you're taking at the time of pregnancy, that's at the time of the conception and the first few weeks after the conception when the baby's first growing, that can reduce the malformations in the baby. And in addition, there's evidence in women with epilepsy that taking that folate during that time improves the baby's cognitive outcomes. Once a woman becomes pregnant, it's important for her to not reduce her medicines without talking to her doctor, because this could be a dangerous situation. She should also contact her doctor who's taking care of her epilepsy, in addition to contacting her OB, because they need to re-counsel her, and for many medicines they need to recheck the levels, because during pregnancy your metabolism changes, and it's not uncommon for some of the major anticonvulsant drugs to drop their levels by half. And you can imagine if you drop your blood level by half, your risk for seizures will go up, which could be detrimental during the pregnancy for sure. I would like to say that it's really the convulsions we worry about the most. Unless you're driving, then we have to worry about the seizures where you lose awareness too. But if you're not driving, then it's really the convulsions that pose the greatest risk to the mother and to the baby. Once your baby is born, there's several things you need to be aware of. One is that you should contact your doctor, because if they had to adjust the dose up during the pregnancy, you may have to adjust it back down. You usually do have to adjust it back down in the first 2 weeks after the baby comes. Once you go home with your baby, you should be cautious if you're having seizures where you have convulsions or jerks or drops attacks, or even the staring spells with loss of awareness, about carrying the baby around just with your arms. I recommend using a sling or an umbrella stroller to scoot them around the house and then get on the floor or get on the bed to play or whatever you're doing. It's also important, if you have those kind of seizures, not to give the young child a bath by yourself, because the baby, if you had a seizure, the baby could fall over because they're not sitting yet and fall in the water and drown. It's fine to do it with somebody else there, or to take a wet wash rag and do it on top of the bed where you're not putting them in a pool of water. The other thing after the baby comes that you should consider is that I strongly recommend that women with epilepsy breastfeed, even if they're taking anticonvulsant drugs. We have several studies now to show that it's of no detriment, and even one study, the one done at the oldest age, at 6 years of age, suggests that the babies are smarter if the mother breastfeeds them. Other important things to consider after the baby comes are that you're very likely to get sleep deprived because the baby is awake and feeding many times, and you need to have help with this. It's important. Being sleep deprived markedly increases the risk for seizures, so they need to plan ahead. Get help from your spouse or the family to maybe do the feedings in the middle of the night, maybe pump milk if you're breastfeeding to give that at the middle of the night, or supplement with bottled milk so that you are getting adequate sleep. Otherwise, this would increase your risk for seizures. As your child grows, things to watch out for are whether you think there might be developmental delay or behavioral problems. Again, most of the babies are going to be normal. The vast majority are going to be normal, but there's increased risk. And so we have a low threshold for considering intervention, because early interventions, if a child is having a problem, can have improve the outcome. So if there's some concern about behavior problems or language delay or motor delay, I would encourage you to talk to your neurologist, talk to a pediatrician, so that they might be referred for a formal evaluation earlier rather than later.